Some insurance companies believe that a significant proportion of whiplash claims filed in Britain today may be exaggerated or totally false. For doctors, trying to distinguish between real claims and fake ones isn't easy.
Declan, come
Yes.
on in.
Thanks for seeing me.
Hi there.
How you doing?
Please have a seat there. And first of all, we'll start at the top of the head. So, any problem when I do that?
No, that's fine.
No, great. I want you to look way up in the air for me. That's extension. And away down, forward, far as you
Rodney Peyton is a leading medical assessor for whiplash. But whiplash doesn't show up on any x-rays or scans, so in the end it comes down to whether the patient sounds plausible.
To say that somebody's lying is very, very difficult. If you tell me right now you've got a sore neck, I have no idea. You tell me you've got a sore neck, I have to accept you say that.
So you have to give me
So I look underneath that. I give you the benefit of the doubt, and if everything is reasonable, then it's reasonable.
What is whiplash?
Whiplash is not a medical diagnosis. It's a lay statement of a method for which this injury has occurred. It's like tennis elbow. Can be caused by backhanded tennis, but most people get a pain in their arm. It's not due to playing tennis. So whiplash is a mechanism of injury. What we're actually talking about here is a musculoskeletal strainage to your neck. The muscles and the skeletal system have been hurt in a road traffic accident. And as soon as we get rid of all these myths about whiplash and how it happened, how it didn't happen, and get round to saying, was this person or was this person not hurt as a result of a road traffic accident, then we get rid of a lot of the surrounding myths and discussions.
So it's not one particular injury, it's a range of different...
It's a range of it. It can be forward and back, it can be round to either side, it can be what we call a shearing motion. It can be if you have your headrest maladjusted at the back, if it's up to where it should be, the back of your head hits the headrest, that's fine. But if the headrest is low, it goes up and over the top. So obviously you have a bigger stretch as your head goes over the top. So there are all sorts of different things you have to take into account in the car, in the mechanism. Was there an airbag? All these things count when you're starting to discuss as whether somebody did or did not hurt their neck in an incident.
As you know, I don't have whiplash, but if I came into you and said that I had a sore neck, what kind of things would you be looking for to make sure that I wasn't faking it?
Three things we look for are consistency, congruency and reasonableness. If you tell me you've got a sore neck, I can't tell one way that you say it, then you have it. So I'm looking, is your story consistent? Are your movements congruent to what you say you can do and what I can find that you can do? Do they match? And is it reasonable in the circumstances? So those are the things that are going through my mind when I'm questioning you or when we're doing an examination, so that I can see whether or not, in my opinion, everything matches.
Walk me through the kind of physical exam that you might give someone to see what their injury might be like.
Sure. We start with the history. I mean, that's where I start to get the reasonables thing, you know, looking at what happened in this car accident, if that's what we're talking about. You know, were you moving, were you stationary, were you hit from behind, the front or the side?
Are there treatments for whiplash, or is it just time?
That's very interesting. Actually, when you get a whiplash injury, the reason it takes a couple of days to start off is because you get edema or swelling in the muscle tissue. So therefore it stiffens up over 1 to 2 days. Now if you go and add deep heat or something to that, or go and have a nice hot bath, it swells even worse and you're liable to get even more stiff. So just like a sportsman after a heavy match, the first thing you want to do is get some ice on it, cool it down, stop the swelling, stop the bleeding. And once you've got that over the first few days, then you have the minimum of swelling. After that, then you want to start the movement, your physio, as soon as possible, and that's the time when maybe a bit of heat will help if you're persistent pain over the, after the first week to 2 weeks. But certainly the last thing you want to do is have hot, relaxing baths and a lot of deep heat put on those muscles just to begin with. If you do that to a sportsman, they won't be playing next Saturday,
So do you want to walk me through the actual physical exam that you would do with people here then?
Sure, just stand up. We'll not pop your shirt up, but just stand over and I'll show you some of the things we do. Just turn away from me and just face the power wall, would you? And first of all, we'll start at the top of the head. So, any problem when I do that?
No, that's fine.
No, great. Now, just look away up in the air for me and right away down to the ground. Great, and straighten up again now. Excellent. Have a little look over the left shoulder and the right shoulder. No particular problem doing that?
No.
And just cock your head over to one side and the other side. Okay?
Yeah.
Now, I just want to feel what's going on down here. First of all, some light touch. Any problem down the centre of your neck there? Or down the sides, on either side, across here? Or down between the shoulder blades? Okay, now just keep your head steady. I'll just go a little bit deeper. Any problems down anywhere there?
No.
And over that bump there? No. And down this side?
That's fine.
Nothing down there? Out across the shoulders are there? What about this side? Anything there?
That's fine.
And down there. Now, just bring your arms up for me, and right away forward, and back, and down again. No trouble with that?
No.
And just pop your arm for me. Now, just let me take your arm, now, just let it sit there, okay? Now, I'll squeeze my fingers real tight. And can you feel me touch you down there?
Yeah.
And there, and there. Now, just pop that one on there. Squeeze my fingers real tight. Great. No problem with the feeling down that side, or that side, or out to the fingers.
No, that's fine.
Okay. And if I was dealing with your neck, that's the main thing. So if it goes further down the back, then I'd start looking at your back and various other movements
So
in the back.
what were you looking for there? Basically, if I had said I felt pain at some point.
Well, pressure on the top of the head doesn't normally cause any particular problem, right? So if you sort of collapse on the ground, I've got a bit of a problem with that.
Right, right.
And if I do some light touch down there and you're wincing and moving about, again, that's not congruent.
So these are things that might actually catch people out, perhaps?
Well, they do. They're not. Yeah, they're not done for that, but they give me an opinion as to whether or not they're slightly exaggerating or not.
Right,
Okay. Some people feel they have to. Others don't. But then as you get deeper, we go down specifically down the spine over the bump at the back, which is the 7th cervical vertebrae, and see where that's going. And then slightly deeper down the neck, across the shoulders, and down between the shoulder blades. Usually between the neck and the upper inner aspect of both shoulder blades, just this sort of area of your back. If you feel the muscles go on tension out there, and you can actually feel it, that's indicative of some spasm there. Now, you can't make that happen, so if I feel that, that's an objective thing for me that tells me that you are having some spasm in the muscle, and, you know, it points to something being genuine when they're sore at the time.
To some extent, there are things you can't feel there.
There are some things you can feel, like spasm in the muscle. And then we're looking for sensation down the arm. The sensation from your neck comes straight down the arm, what we call dermatomes, or coming straight down there. So if you've got a problem with a part of your neck, maybe the outer part of your arm feels a bit tingly and numb, but the inner part's okay. On the other hand, if I go right down to here and it's numb from here all the way down to the hand, that doesn't match any anatomical sequence. And so we'd be saying to ourselves, this doesn't seem quite right.